Welcome to our 10-minute session on the diagnosis and treatment of cerebral infarction, a condition that can severely impact one's ability to walk and lead to a significant decline in their quality of life. Let's begin by addressing a question that may resonate with many of you. Have you ever experienced a situation where someone you know, like Mrs. Wu, a 60-year-old retired worker, started facing difficulty walking after suffering from a cerebral infarction? Her once active life was disrupted and she became reliant on a walking cane for mobility. The causes of cerebral and heart infarctions are often linked to irregular dietary habits, chronic sleep deprivation, and excessive alcohol consumption. Irregular eating patterns, staying up late, and consuming alcohol just before bedtime disrupt the body's digestion, absorption, and metabolic functions. This disruption hinders the proper breakdown and absorption of nutrients in the bloodstream, leading to the formation of blood clots. In Mrs. Wu's case, her condition was indicative of cerebral infarction. A critical aspect of diagnosing cerebral infarctions is the examination of the tongue. A stiff and immovable tongue, or severe distortion, is often a clear sign of cerebral infarction. If the tongue deviates to the left, it signifies a blockage on the right side of the brain, whereas a rightward deviation indicates blockage on the left side. An enlarged, stiff, and swollen tongue that is difficult to lift suggests blockages on both sides of the brain. Our diagnosis aligned with medical examinations conducted at the hospital, confirming the presence of cerebral infarction. Now let's discuss our treatment plan. We employ a twofold approach to address cerebral infarction and its associated challenges. First, we use gua sha, or scraping therapy, to alleviate the strain on the heart and reduce cardiac stress. This aids in managing blood pressure and lessening the burden on the cardiovascular system. Secondly, we employ a technique known as Pi Duo, which helps reduce intracranial pressure and promotes the removal of clots, obstructing blood flow in the brain. This approach aids in restoring blood circulation to the affected areas, thus facilitating recovery. After receiving our treatment, Mrs. Wu's condition improved significantly. She no longer required a walking cane, her mobility was restored, and her overall well-being showed marked improvement. Cerebral infarction is a serious condition, but with the right diagnosis and treatment, significant progress can be made in restoring one's quality of life. If you or someone you know is facing similar challenges, it's crucial to seek timely medical attention and explore comprehensive treatment options like the ones we've discussed today. Thank you for joining us in this informative session on cerebral infarction diagnosis and treatment.